Good morning, everyone. My name is Bipin Kumar. I'm a volunteer with the CSPC Events Committee. Welcome to the CSPC Events, uh, Bridging Minds and Borders in Conflict, Canadian Red Cross evidence-based support to Ukrainian Red Cross to strengthen Ukraine's health system and innovations in conflict psychotherapy. I will now pass it on to Dr. Faiza Raab to moderate the event.
Thank you very much, Ben. Much appreciated. My name is Faiza. I'm the Senior Manager for Global Health Research at Canadian Red Cross. Thank you, everyone, for joining this morning for this virtual symposium on bridging minds and borders in conflict. Canadian Red Cross's evidence-based support to Ukrainian Red Cross to strengthen Ukraine's health system and innovations in conflict psychotherapy. Thank you. The is situated upon the traditional territories of Erie, Neutral, Huron-Wendat, Haudenosaunee, and Mississaugas. This land is covered by the Dish with One Spoon Wampum Belt Convent, which was an agreement between the Haudenosaunee and Anishinaabe to acknowledge that this land is covered by the Between the Lakes Purchase 1792 between the Crown and the Mississaugas of the Credit First Nations. Today, our presenters will talk about the support that Canadian Red Cross have been providing to the Ukrainian Red Cross since the escalation of the conflict in 2022 in Ukraine, and also to the mental health side. Celine Garvey. Celine is a humanitarian professional with over 7 years of experience with the Canadian Red Cross in emergency operations, international partnerships, and risk management. She's currently the Senior Manager for Europe region, where she focuses on supporting partnerships and programming across the region, including Ukraine, Lithuania, Turkey, Poland, Moldova, Bulgaria, and Hungary. Celine is based in Ottawa and had previously held roles at Canadian Red Cross in international emergency response partnerships in Americas and Africa's and risk and incident management. Celine holds an MSc in International Relations from University College London and an Honours Bachelor's of Arts in. All right. So we also have Dr. Sabina Voronetska, who's a Ukrainian physician based in Kyiv. She also joined Red Cross movement in 2022 at German Red Cross. In 2023, Sabina joined the team of Canadian Red Cross as a health coordinator. Sabina has a medical background and holds MS in health economics, policy, and law. And we have the privilege of having Dr. He's based in Lviv. He's the head of psychological and psychosocial rehabilitation unit Unbroken, First Medical Unit of Lviv, Ukraine. Also served as an assistant professor at Lviv National Medical University with prior experience at the Lviv City Council, including roles as head of the Mayor Administration Department 2007 to 2012, and Director of Department of Humanitarian Politics and Acting Deputy Mayor of Humanitarian Issues from September 2012. He has been a member of Ukrainian Parliament from 2014 to 2019. So as you can see, major concerns when it comes to barrier in providing healthcare in conflict zones, but there is political instability and lack of resources. I can't see the poll right now, but from what I gathered, it is the mental health support is not as emphasized, according to majority of you. Some of you, it's very effective, the integration between multiple disciplines, and most of you are neutral about that. Thank you for sharing your thoughts. So we'll move on to our panelists with our questions. My first question is for Celine. We want to ask you, how did the Canadian Red Cross use their previous experience and evidence in supporting mobile health units and adapting to the unique challenges posed by the conflict, especially in Ukraine? And what lessons can other humanitarian organizations take from this model? And can you speak about your experience supporting the Ukraine Red Cross bridging the gap for access for primary health care?
Thank you so much, Faiza. I hope everyone can hear me well, and thanks for joining our session today. So, yes, I'd be happy to speak a little bit about our experience as the Canadian Red Cross with mobile health units and how we've been able to use this concept and the evidence base that we've gathered over at least a decade now to adapt this tool in support of the Ukrainian Red Cross and their work across the country. So I'm going to talk for about 10 minutes and show some slides to provide a little bit of an introduction to what mobile health units are, and then discuss as well the experience of Ukraine more specifically. But first, perhaps to say that Canadian Red Cross works extensively internationally in our international cooperation work. We always work in collaboration and partnership with the local Red Cross or Red Crescent Society. And so we have in 191 countries around the world, local Red Cross or Red Crescent national societies that are at the forefront of locally led humanitarian action. And they know the communities, they're embedded in the local communities with their staff and volunteers, and they're present before, during, and after a crisis. And this is very much the case of the Ukrainian Red Cross as well. So just going to explain a little bit about the Canadian Red Cross experience with mobile health units. So before I go to this slide, just to say that we've been working in this area for over a decade, and it's one of the ways we've been supporting our sister national societies to deliver primary health care to communities, especially those that we call last mile communities, or the most difficult to access and reach, the people who have sometimes the most vulnerable and require this kind of innovative model to reach them. And so for over a decade, we've been working with our national society partners across the globe, in the Americas, in the Middle East, in Africa, in Asia. Some examples include in South Sudan, where the mobile health teams worked on preventative and curative health care to women and children affected by armed conflict. In that case, a lot of the focus was on reproductive and maternal and child health. In Afghanistan as well, there was a focus on midwives, wound care, and setting up 3-week posts in different communities where people could have access to mobile services. We've used different models, like using vehicles, using bicycles, using temporary posts in community spaces in different contexts. And so those are just a couple of examples to provide a bit of an overview of what we had done in the past before the escalation of the humanitarian crisis and the conflict in Ukraine. But in Ukraine specifically, we've been working with the Ukraine Red Cross Society since 2022, so since the escalation of the armed conflict. And we work in partnership to support activities that the Ukraine Red Cross Society is implementing in the areas of health, but also in shelter, water, sanitation and hygiene, also on protection, gender inclusion, and ensuring community engagement and accountability. We work also on strengthening the Ukrainian Red Cross Society according to their priorities, and in improving operational leadership to be able to deliver services to people in very difficult situations. The Ukraine Red Cross Society is at the lead agency in Ukraine, the lead local agency distributing humanitarian aid, responding to damage to civilian residences and infrastructure related to the hostilities, and also doing the really important work of providing first aid, psychosocial support, delivering support to medical facilities, and also working with people who've been displaced internally within the borders of the country, and much more. We could do a whole presentation on the work of the Ukraine Red Cross in Ukraine. And so we're working in coordination with our partners, with the International Federation of Red Cross and Red Crescent Societies, with the International Committee of the Red Cross, and with other like-minded sister national societies that are working in solidarity with the Ukraine Red Cross. So we're going to now jump in and discuss a little bit about the MHU concept. I'm going to go here. and the health concept and what we're doing to support the Ukraine Red Cross. So since 2022, we've been supporting mobile health units, which we're going to dive into a little deeper, and we're also supporting home-based care since 2023. So this is an adjacent health support to the mobile health units, and it's where we have social helpers from the Ukraine Red Cross going into people's homes and providing support in terms of basic household tasks, monitoring blood pressure, taking medication, as well as some light cleaning and help preparing meals and things like that. We also are supporting mental health and psychosocial support, which we'll be discussing a bit further. And then with the Lviv Hospital and Mental Health Center, we've supported the development of nursing skills and also provided direct support to the mental health center, which my colleague Dr. Berezouk will be speaking to a bit in a moment. But to really dive into the mobile health units, this is something that we've worked on with the Ukraine Red Cross Society and other partners in Ukraine. And we've used the evidence that we've gained over years of working with this model in other contexts, and what we know from other contexts is that this model of the Red Cross or the Red Crescent in the context being able to be right beside communities to approach them in their homes and their communities is really critical to reaching those who are the most likely to be left behind by health systems, especially in crisis settings and in conflict settings as well. So it's a temporary support of state health authorities in providing high quality medical care to people affected by conflict. And it's, as I mentioned, it's temporary, it's an emergency support. It's not a long-term replacement. So it's not meant to replace the government or the state authorities, but it's meant to augment, especially in situations of crisis. And all of the mobile health units are linked to local primary health centers. So here you can see a picture with Ukraine Red Cross medical workers. So they're nurses and doctors that are traveling in the equipped vehicles with medical supplies and equipment, and they visit different communities across Ukraine. And they're able to, each vehicle with the team are able to see usually about 20 patients per day. And so across all of Ukraine, there are about 125 mobile health units that are operating, and they're able to do an incredible number of consultations per month, about 49,000 per month across the country. In the case of Ukraine, I mentioned before that in South Sudan and Afghanistan and other contexts, reproductive and maternal child health services was one of the big focus areas of the MHUs. In the case of Ukraine, the demographics are quite different. It's an aging population, one of the oldest populations in Europe. And because of the situation of armed conflict, there are many older people who have become isolated, especially those living in rural areas outside of cities. There's a reduction in the availability of healthcare professionals because of the conflict. Of course, some of those healthcare professionals are engaged in the mobilization of people towards the front line, but also many people's adult children are either mobilized or they have decided to leave Ukraine due to the situation and the security situation in the country. And so many older adults are left alone, and the MHUs that we're supporting in partnership with the Ukraine Red Cross are really meeting a critical gap and augmenting the capacity of the local health authorities to ensure that these people aren't left behind and that they're able to access the critical medical care and medicine that they require to remain healthy. So here you can see a map of the country of Ukraine. And so as of October, the Ukraine Red Cross Society had 125 MHUs running across the country. You can see there, the numbers are there for 2024 and then for 2025. So there's been a slight scale down in some areas, most areas related to the needs and related to the strategic prioritization of the Ukraine Red Cross. But you can see that there is a very good geographical spread of this service for people requiring this support across the country. Just going to move to the next slide here. These two oblasts or regions are where Canadian Red Cross is working hand in hand with our colleagues at Ukraine Red Cross. So Ukraine Red Cross is the actor that's doing all of the work on the ground, and our team is providing financial support as well as technical support. So in 2024, in Poltava Oblast, we had 6 MHUs and then, 5 MHUs in 6 MHUs in the Cherkasy Oblast. And now, as I mentioned, there's been slight reduction. There's 4 in Poltava Oblast and 4 in Cherkasy Oblast. And as you can see, these are areas in the center of the country. Although they're not in the frontline areas, they are regularly by hostilities, by strikes, and as I mentioned, many people are impacted by the population movements and the mobilization of people, and many older adults are in need of this specialized care to reach them in their communities. So this, just to work on wrapping up here, I just wanted to show a couple of figures. So as you can see, there's a significant number of consultations and the demand is still there over time. So in December, about 3.2 thousand consultations per month in the Poltava Oblast. As you can see here, there's about 75 consultations per day with the five mobile health units in that area. And you'll also see that most of a large percentage of the consultations are requiring medication. So a lot of what we're seeing, the teams are seeing there are things like diabetes or cardiovascular diseases or other non-communicable diseases related to aging, and many people do need prescription medication to properly manage their conditions, and this is something that the mobile health units are supporting. The mobile health units also refer people to additional care if needed, if there are medical concerns that can't be addressed by the MHU teams. And similarly here, in Cherkasy, you'll see there's also a large number of consultations per day, about 88 on average, and also significant number of people requiring medication to manage their conditions. And so this is quite an important service that really helps to meet the people in the last mile who may not receive quality care otherwise. And the last slide here is just to show some of the innovations that the teams are working on in the field. So the ECG telemetry and telemedicine consultations. So in Poltava Oblast, the Red Cross teams are working to establish and improved telemedicine consultations for people. So they may be seen by a mobile health unit, but then also be able to receive additional support via telemedicine. And this helps to be able to maintain contact with people who are in more remote areas, and make sure that they continue to have contact with the healthcare system. And then here on the right side, you'll see some clients. You'll see some MHUs visiting clients of the home-based care program. And so this shows the complementarity between the program where social helpers are going to visit clients on a regular basis. If needed, they can flag concerns or needs for additional support to the MHU teams, and the MHU teams are able to conduct home visits to ensure that people are receiving the follow-up and the care that they need. So I think I don't want to take much more time. We have a lot of content to share, and we'll be happy to answer questions at the end as well. But just in general, I think it's been a great example, this experience of working on MHUs in Ukraine, of how different tools that we use globally and that we've seen to be effective in reaching last mile communities, it can be adapted for different contexts. This is a totally different context than South Sudan, where there's a young population, there's a lot of need for reproductive and maternal health care, and now we're working in a context where non-communicable diseases and ailments related to aging are much more prevalent. And by working closely with our counterparts and following the lead of the Ukraine Red Cross Society and their priorities and their knowledge of their context, the Canadian Red Cross has really been able to contribute to supporting a model that's fit for purpose in the context of Ukraine, and that helps people to remain connected to primary healthcare systems despite the challenges that have arisen due to the armed conflict. So, Faiza, I think I'm going to stop there, and we can move on to the next question and the next presentation. Thanks.
Thank you very much, Celine. Indeed, Sabina, can you speak more about the specific training and capacity building programs offered by healthcare professionals, particularly at the Lviv hospital, and how do these programs impact the long-term sustainability of healthcare in conflict zones?
Yes, thank you, Faiza, for your question. Good morning, everyone. Thank you for being online with us today. I'm just gonna share my screen quickly. So today I will briefly talk about the trainings for nurses in First Medical Union of Lviv that were a part of Ukrainian Red Cross project that was supported by Canadian Red Cross. But first, just a quick introduction about what this presentation gonna be about. I will briefly provide you with health context in Ukraine, a general outline of the project that was implemented, trainings that were created and delivered in 2024. So, as you may know, from 2016, healthcare reform started in Ukraine. There was introduction of paramedics and emergency departments. There happened evidence-based medical care standardization. There were changes in trainings, education, and licensing. And also, state-funded medicines and services were introduced. New funded structure was also introduced. And speaking about all of these, as you all know, also Ukrainian health system undergoes necessary and important changes, but also faces several changes such as ongoing international armed conflict. So this project was implemented by Ukrainian Red Cross with support of Canadian Red Cross in the First Medical Union of Lviv, which is the biggest medical facility in Ukraine. And currently there are 2,500 nurses that are working in the First Medical Union of Lviv. So the project aimed to support nurses training on hands-on skills, creating training materials, and also boost nursing leadership as the First Medical Union of Lviv. So FMUL, I'm gonna then say it more shortly, consists of St. Bartolomeo's Hospital, St. Luke's Hospital, St. Nicholas Children's Hospital, and National Rehabilitation Center Unbroken. The activities of this project, mainly topics of the trainings and the content of the trainings, were created in close collaboration with the management of the First Medical Union of Lviv. As a part of this project, medical equipment, mannequins were procured for the newly built training hub located in the St. Bartolomeo's Hospital premises. Also training materials, mostly it was reading materials or presentations. Pre-training and post-training tests were made on IPC, managing bedbound patients, supporting patient elimination, injectable medication and therapy for nurses, and nursing skills courses. So in total, 5 courses. And also during the training of nurses, training of trainers was happening. So on this slide, you can see the general number of nurses that were trained in IPC, Infection Prevention and Control. In general, it was 352 nurses trained and 11 nurses trainers. So future plans of the hospital management regarding IPC training is that all the nurses in the hospital should receive this training, and according to the latest updates that we have, actually all nurses received such training, and now in 2025 then they're gonna have a refreshment course. So as you can see from the pictures, there are some examples of how the training was going on. I would just like to take a moment and to say to you that on the background, you can hear my dog barking. I'm really sorry for that. So yeah, I hope it's not that loud. So our colleague Faiza, who is today a moderator during this panel, was in Ukraine, and in the end of February and beginning of March, she gave first trainings in IPC. It was a 2 day training that consisted of theoretical part and interactive part, quizzes, discussing examples from work. Also, CRC trainers provided training for nurses and for nurses trainers, so that in the future they could train other nurses from First Medical Union or Lviv. While CRC trainer was still in Lviv, nurses trainers were already starting to deliver training under her supervision. So here there are some examples of the feedbacks that we received from nurses. So after all trainings, we asked nurses to fill in the online form to hear from them what do you think about the content, theoretical and practical parts. In general, nurses thought that information was very useful for them in practice, and sometimes they also learned something new. And recently, last week, we've been in Lviv for a working visit, and we had a chance to speak with nurses again who took that training, and we heard from them that receiving this training helps them to control the everyday tasks that they are doing, and they also now have this knowledge and power to share this knowledge with their colleagues and with the patients that are staying in the hospital. Also, then in the end of spring, in May mostly, other 4 trainings were delivered by our colleague, Lynn Henderson. So she also was in Lviv, and she provided trainings both to the nurses, and she also was involved in the training of nurses trainers. And while she was in Lviv, also nurses trainers were already providing training, and Lynn was providing them with advice, and she was basically supervising how they're doing this. So usually how the trainings were set up, nurses received pre-reading materials before the training. They also received pre-test that they passed. Then in the class, they had the theory part, which was a formal presentation. Then it was practicing on hand skills in the training lab that you can see some pictures on the screen right now. Also, nurses then passed the post test. Again, the plan was for all nurses in the hospital receive the trainings in those different topics, and again, the hospital succeeded in managing this goal in 2024. So, what are the main achievements and accomplishments? So, first of all, nurses trainers shared with us that they had more respect for other trainers and in general for people who provide those training, and now they know what stands behind this work. It's also an achievement of engagement of nurses in their own training. It's also creating a web of nurses trainers who, after the project ended in August 2024, still continued to train other nurses. Also, it's teamwork, and it also was a connecting nurses internationally, because Lynn, who was introduced previously, she's a nurse from Canada, and she was sharing her experience as a nurse in Canada, and nurses from First Medical Union of Lviv gladly shared their experiences. One challenge that was shared with us by nurses is the challenge of lacking of time. I think most of us face it, but for the nurses and for the doctors and for medical professionals, it's very critical in the hospital when there is a lack of human resource, when in your country the international armed conflict is ongoing and causes you a lot of stress. But still, nurses managed to find time, either after work or during their free day, to come and receive those trainings. So here again, there are some pictures of trainer nurses in action. So as I said before, the plan of the hospital is to continue training their staff, disseminate the knowledge, and improve the quality of care for the patients, and also boost leadership skills of their nurses in their hospital. Thank you very much.
Thank you very much, Sabina. It was indeed inspiring to see how motivated the nurses were in Ukraine to get that training. I would also like to thank our teammates at the Global Health and Research team who provided a lot of back supporting work for some of these creation of these modules and training modules. But it was really inspiring to see how transformative that process was, and especially in the conflict settings, that is indeed a feat. So, over to our next panelist, Dr. Berezouk. We would like to ask you about the collaboration between the Lviv Hospital and the Canadian Red Cross to support psychotherapists using innovative therapies like full body therapy, which was fascinating, and we would like to hear more about that. And can you also elaborate about how these approaches differ from traditional psychotherapy and what impacts it's having on patients, especially prisoners of war and civilians during the combat? And can you talk about integrating the evidence-based learning? Over to you, Dr. Berezouk.
Thank you, Faiza, for your introduction. And first of all, on behalf of our team in First Medical Union in Lviv and National Rehabilitation Center, broken from all our employees and our patients, we would like to express our gratitude and appreciation to Canadian people who stands with Ukrainian people in this brutal war. Special thanks, of course, for Canadian Red Cross. Thank you for your care and support. For already 3 years, we are working together, and we are started our cooperation 2 years ago and trying to develop it every day. And we had a goal at the beginning to develop a new model for mental health in Ukraine, and new model that would fit the needs of the war. And I think now I can say that our efforts are quite successful and beneficial for people. And I would like to share with all of you information about this. First of all, would you please next slide? First of all, I would like to say that we have two main challenges that we are facing now as doctors and psychotherapists and psychologists. The first, it's a quantity of patients we have never seen before, and the second one is a lack of personnel, lack of trained psychologists, psychotherapists, and psychiatrists that would be expert in the war trauma, because severe TBI, concussion, PTSD, and moral trauma are enormous challenges because of severity, quantity, and profound negative impact on the healthcare system in Ukraine and life quality of majority of people, including military personnel, civilians who suffer from combat trauma, trauma of captivity, and trauma of torture. And 72% of Ukrainians felt stressed by the full-scale war and events related to this. This is a very recent 2024 year results. And we have not only PTSD or trauma-related reaction, we have already a lot of psychosomatic consequences of profound stress and continuous stress. Also, we can observe that PTSD leads to risky behavior, that leads to alcohol, drug abuse, destructive behavior, and related consequences. At the beginning, next slide, please. At the beginning, the Minister of Health of Ukraine, Mr. Leshko, had an approximation that this is the 15 million Ukrainians will need psychological support. 3 to 4 million will require medical treatment. Now we can see already that the approximation is already was underestimated. Now we have much more people who need our help. We have our own statistic from our own hospital that we can say it, that approximately 28%, more than 28% patients who are coming to our hospital from the combat zone diagnosed with the PTSD. So it's almost 30%. And those people who are coming to us with any mental issues, it's 100% of them has a PTSD or PTSD related symptoms, which is very important to know. This is a value. Next one. We also found out a very important issue that more than 60% of the people who are coming to us with the mental health problem have a severe and more than 90% have severe and moderate depression. And in the general population, all of people who are coming, 20% have a severe and moderate depression. Next one. The same thing we have with the anxiety disorder. More than 90% have anxiety disorder who has some issues of mental health, the people who are coming from the combat zone to our hospital. Next, please. So having these challenges, the challenges of quantity and quality, we, as I said before, have a goal to build a mental health model in the Medical Union that could be successful and can be spread and transferred to other hospitals in Ukraine. And before saying about this model, I would like to say that in Ukraine, mental health system is still very like Soviet system, which is usually located in isolated, high stigma psychiatric hospitals. So we decided that we will open a mental health center and psychiatric hospital as a part of general hospital. Would you please, next slide? So even before the war, we start to do this, to make psychiatry more open to society and to return psychiatry to the family of medicine. That's why in September 2021, we opened a first psychiatric ward as a part of general hospital. Next slide. And during the war, in May 2022, addressing this challenge of quantity, we are opening a mental health center as a part of general hospital. The mental health center who is not only working with psychiatric problem, but also using psychotherapy and clinical psychology and psychosocial psychology to help people who suffer from the war trauma. Next one. So, and from 2022, we treat civilians, IDPs, military personnel suffering from mental disorders related to mental and physical injuries of war, captivity, and torture. From May 2022 to December 2024, 9,700 patients were treated in the mental health center and First Medical Union, including civilian, military personnel, members of soldiers' families, captivity, people who suffer from captivity and torture, moral trauma. More than 20,000 therapeutic sessions were conducted in our center. Next one. Besides clinical activity, of course, we are addressing our challenge of lack of the personnel, lack of the trained psychologists, psychotherapists, psychiatrists who can work with the trauma, war trauma. That's why we are start to develop an educational and research center for problem related to war trauma. Next. And during our work, clinical and research, we are developing protocols for treatment of people who are affected by the war. This protocol have a few parts. The first one is pharmacology, pharmacotherapy. And I would like to say you this is a very common knowledge now, but only 30% of the symptoms of PTSD or trauma-related mental disorders can be treated by pharma. 70% must be treated by special instrument of psychotherapy. This is the body-oriented therapy, EMDR therapy, prolonged exposure therapy, art therapy. And this is not only the word. We are trying to develop a protocol of each of this therapy that is address a very exact symptomatics. For example, the body-oriented therapy is a therapy we are using when the person is not talking, yeah, and it cannot communicate, and it's really helping people to find a way to cognition. EMDR, you are very, you know about this, a very simple and successful instrument to help people with acute trauma and people that would like to address the chronic trauma. Our therapy, this is a special therapy that we are developing here, and it's connected to prolonged exposure therapy, but it's kind of even more successful because prolonged exposure therapy, during the therapy, people have a very high tension, recalling those very bad events that happened during the combat. During the art therapy, we have a less tension and most and very using the projective drawing and very soft exposure and effective results. And besides psychotherapy, we are using instrumental therapy. This is slow shift vibration therapy, which is helping us to make equilibrium between sympathetic and parasympathetic neurosystems, and transcranial magnetic stimulation. By the way, transcranial magnetic stimulation was certified for use for resistant depression first in Canada. And neurofeedback, the very new technology, which is very promising and helping people not only overcome the symptoms, but also help to change the style of living, which more adapted to the new body and social circumstances changes. And of course, the most important thing in our protocols is a teamwork. Teamwork which conclude a clinical rounds of primary patients who are coming to our hospital every week by the special evacuation train or buses from the east part of Ukraine, from the war zone. And every Monday, today including, we have in the morning, we have a clinical round of mental health practitioners and evaluation of patients who came during the previous 3 days or 4 days. And and this is a very important. It's kind of triage and psychological triage of the patient who needs help immediately, who can be helped later. Second, the clinical consultation of the complex cases. It's like clinical conferences, and it's also happening once a week on Monday too, for example. And of course, the supervision and intervention groups of the psychotherapist. And it's also happening 2 times a week, and it's very important instrument, not only for more precise diagnostic and treatment of the patient, but also like a prevention instrument of the secondary PTSD in among psychotherapists, psychologists, and psychiatrists. Next slide, please. Of course, we are not alone, and our educational program and cooperation in developing the protocols in a very tight relationship with our partners is a Charité Clinic and University in Berlin. It's a Yale University in New Haven, United States, and Tulane University from Tulane University, USA, and the Center Primo Levi. It's a In Paris, it's a very experienced center working with the patient after captivity and torture, which really help us to understand this issue. Now, even in this moment in the hospital, we have more than 30 patients after captivity and torture, which is completely different approach to be taken to take care about this very severely mentally and morally and physically injured people. And of course, our partner, as I said at the beginning, Canadian Red Cross, which are not only our partner in educational program, this is the partner, full-scale partner, which is helping us to develop a model of care. And for us, it was very, very important to know that in case to help us, the Red Cross should change their internal policy. For us, it's a great sign of care for the people who need help during the war. Would you please next slide? So we can say that this is two main institutions that make us successful in working with the war trauma. It's a Red Cross, a Canadian Red Cross, and Lviv IT cluster, which help us with the infrastructure problem that we have during this 3 years. And very important to say that our activity, mutual activity with the Red Cross, Canada Red Cross, was noticed by the Ukrainian government. And 3 weeks ago, the Prime Minister of Ukraine, Minister of Health of Ukraine, conducted a special meeting in our hospital, inviting head of the public health offices in all regions in Ukraine, and we discuss a possibility and opening a mental health center in every big regional and city general hospitals. And actually, it's an order of ministry to establish such centers. And the next few weeks, we will perform here a special educational courses for chiefs of general hospitals. It's going to be more than 300, 400 people that would come to our hospital, and we would share our knowledge, how to establish the psychiatry and psychotherapy departments in the general hospital, how to train own personnel to work with the war trauma. And for us, it's a great privilege to help other Ukrainians to combat mental health problem during the war. And for us, it's a privilege and great thing that Canadian Red Cross help us to develop and continue to do this. Not only helping to provide the therapy, but also to learn and to research. Yeah, we are developing together a new research program that is very needed at this moment. Next slide. So we have a plan to share our knowledge with our hospitals and medical institutions in Ukraine, to create an educational center, actually the Unbroken University, and to create a special short-term educational program to educate people how to work with the mental health problem during the war. Next. And at the end of this short presentation, I would like to express our acknowledgement to the very important people from Canadian Red Cross and for the people of Canada who really helps us to be successful. We are not only learn and successfully use conventional trauma therapies, as I mentioned today. And we are also start to provide educational training to teach more therapists. And of course, more research is needed to find most effective combination of psychological instrument to help more people in shorter time. Very important to say that we are on the way to create a neuroscience brain and spinal center, implementing clinical and research activity using fMRI, qEEG, and neurofeedback transcranial magnetic stimulation. Of course, we have lack of experience and of such activities, and near more intensive clinical research and educational cooperation. So, ladies and gentlemen, our main executive goals is to learn, to research, to treat, and to teach. And we are absolutely positive that together we can do more for benefits of our militaries and civilian people who are suffering from war trauma. Our existential goal is to survive and win. Our social interests to stay unbroken and to be resilient. And once again, ladies and gentlemen, thank you very much for being with us and to care about people who suffer from war. And we really appreciate it, and we really want to share our knowledge to help your people to overcome those problems that they're gonna have. Thank you very much.
Thank you very much, Dr. Berzuk, for your presentation and for the amazing work that you do in such difficult circumstances, and the continued innovative approaches that you've been working on and establishing. It's been a privilege working with you, and we hope to continue to do so over time. I see I have a for Sabina in the panel regarding the trainings. What framework was used for training on quality of care?
As for quality of care, you mean, I'm sorry if I can ask another question. If you mean like in terms of trainings, quality of care, because we were having a training on general nursing skills, or you meaning quality of care, how we were assessing quality of care in the hospital?
So I'm not sure it is one of the
yeah, if the person who wrote this question is a really great question, if you could specify, so I'm gonna provide
the assessment of quality of care.
Okay, so I would say that quality of care either before or after the training, it wasn't the goal of this project. Before starting this project, our colleague and our health advisor, she was in Lviv for a few weeks, and she was doing the needs assessments. She was speaking with nurses. She was assessing how they're doing their work, and based on the things that she saw, she provided the recommendations that not only mannequins needs to be in the training hub for the center, but also training courses on the specific topics should be developed. So neither Ukrainian Red Cross nor Canadian Red Cross, we were not assessing the quality of care which is provided by the nurses in the hospital. We were assessing only the quality of training that we were provided by giving nurses pre-test and post-test, and and collective feedback from the nurses on how this training is for them. Yes, thank you for the question, and I hope that I answered it.
Thank you, Sabina. And if I could just jump in, as Sabina mentioned, that these trainings were based on the gaps identified by the hospital itself to improve the quality of care for patients. For example, the IPC training that was delivered was based on a unique niche, and the and the hospital administration and the head nurse, as well as the nursing staff, was of the opinion that there is a need, because there are a lot of hospital qualities trainings would help them reinforce some of the best practices.
Okay, so maybe I don't see other questions in the chat, but really invite any participants to please enter any other questions you have for any of the speakers. But maybe I can ask a question here that we have to Sabina. Sabina, how do you and the teams in the field balance the need for immediate crisis response with the introduction of innovative approaches that might take time to implement effectively in such high pressure environments?
So during conflict, we see a lot of transitions. And then there are transitions into recovery and resilience. Canadian Red Cross, we transition from our acute health response to being resilient in the health recovery. But the conflict is not like my go towards recovery and building more resilience. How do you balance the need for immediate crisis?
Yeah, so regarding the balance, as was mentioned previously by me and by Celine during our presentations, we as a Canadian Red Cross, we work with Ukrainian Red Cross, who is our key partner, and through the needs assessment, and the collaboration with them and collaboration with other partners, we managed to deliver needed support to those people who need the exact service. Yes, so it's more about teamwork, which is also, I think, the same as Dr. Berezuk mentioned in their work. It's the same is for work that we are doing. It's a teamwork, it's collaboration, and it's open channels, and base all of the services that are provided to the population, base them on the need. Thank you.
Thank you, Sabina. Celine, were you about to respond?
No, I was going to ask the next question, but I think you're okay to go ahead.
The next question, I think it's specifically for Dr. Berezuk. How do you measure the effectiveness of these mental health interventions, and what can other regions experiencing similar crises learn from this model?
You have a few measurement instruments. The one is the people to people. And for example, we now have a problem that we have more patients that come into our hospital for specific mental health treatment than it used to be. And this because people are telling each other where to go, and especially the people who suffer after captivity and trauma and torture. The second is we are using the normal instrument as medicine. We are implementing PCL-5 questionnaire for PTSD, PHQ-9 for depression, and GAT-7 for anxiety. Prior to treatment, the people are coming to our center, and of course at the end of the treatment. And this is the most important instrument for us to measure the quality of our intervention. And the second thing is very important. How do people will learn from us? This is we don't worry about this now, because the Ministry of Health, it's an interest of Ministry of Health to share our knowledge, and they will send to us, as I said, during the next few weeks, more than 400 people. It's a chief of the hospitals, and chief of the general hospitals in Ukraine, regional and city hospitals, who would spend a day with us and learning and observing how this model is functioning. And we also developed a special guide how to establish a mental health center in the general hospitals, together with the Ukrainian Coordinated Center of Mental Health Development in our Cabinet of Ministers. And we will share this also during those educational days with the chiefs of the general hospitals. So It's quite intensive course during the next few weeks, and we are very happy that we are developed it during the previous 3 years of our combating mental health trauma of war together with the Red Cross and other people.
Thank you, Dr. Barazu. Thank you for sharing that. I don't see any additional questions in the Q&A. So I would like to we'll have another poll before we close, but before that, I would like to thank all the panelists for sharing their work and their presentations. And before we head on to our last poll, I would like to invite them for any last thoughts.
Sure. Thank you, Faiza. Thank you to Sabina and to Dr. Berzuk for being on the panel today. It's really important for this group in Canada to have voices from Ukraine, people who are there working in the field. So I think it's just, for me, the takeaway that I have is how we can really leverage experiences that we have from many years of working in international cooperation to apply them to different contexts, but that it's so important to work hand in hand with our partners who are based in the context, who understand the different needs and the different particularities, and that we work in a really flexible way to adapt different tools and different methodologies to the context, and also that we continue in all of the work that we do in international cooperation to build the evidence base, to try as much as we can to integrate research into our work, into our humanitarian activities, so that we're able to build that evidence, to share it with other partners, whether they be within the Red Cross, Red Crescent movement, or outside the movement, so that the next situation or the next crisis that we are working with to support can benefit from the lessons that we've learned. And so we're really proud to work with Dr. Berzuk and his team to be working to gather more of this evidence about trauma psychotherapy, for example. And we're really looking forward to a longer term process of gathering the evidence and publishing it. And I think this is in service of the broader humanitarian mission and will be very useful for the years to come, as unfortunately we know that conflict continues around the world and that we're going to need to respond to these incidents of violence. So I'll leave it at that, but thank you very much, Faiza, for facilitating and moderating today.
Thank you, Celine. Before we move on to Sabina and Dr. Berzuk, there is another question in the panel for Dr. Berzuk. Have you developed any specific indicator for measurements for your effectiveness?
No, just as I said, we're using the very conventional instrument to measure the mental health stability of the patient, and we don't developing other because we have no time for this and no need for this. Yeah, if we have a improvement in mental health for patients, we have no problem to believe it.
Thank you, Dr. Berzuk. And your last thoughts on the panel?
As I said, our main existential goal is to survive and to win. And of course, being together with other people, we can do this and we can fight the evil. And our social interest is to be unbroken and to be resilient. And of course, we have to be together to do this, and studying and sharing the knowledge and doing helping each other. And of course, I would like to say thank you to all of you in Red Cross and to all Canadian people who really help Ukraine and specific our project. Thank you for your care and your support. Hug you and love you all.
Thank you, Dr. Berzuk. And Sabina, yours is the last word.
Yeah, my last words also gonna be words of thank you to those who attended today's event online, and as to you, Faiza, for moderating it today, and for all people that are standing behind for organizing this. And also, I would like to thank you, Canadian people, for supporting us during these difficult times. Thank you.
Thank you very much, everyone. Our panelists and all those who joined us, thank you very much for this very inspiring and interesting panel today. And thank you to the organizers. And hope you guys, all of you, have a great day. Thank you.
Thank you.
Thank you.